Hi, everyone, and welcome to our 2021 Self-Direction Virtual Conference Series. My name is Casey DeLuca, and I'm the Director of Membership and Conferences for Applied Self-Direction. We are delighted to have Alison Barkoff, Acting Administrator for the Administration for Community Living, with us today for our keynote session, ACL's Priorities for 2021 and Beyond. You can submit your questions and comments in the chat box at any time during the presentation, and Alison will answer as many questions as she can at the end. So without further ado, we will turn things over to Alison.
Great. Thank you, Casey, so much for the invitation and for the opportunity to be here and speak with folks today. And I really want to thank everybody at Applied Self-Direction and all of the folks participating in the conference for all of your hard work to promote self-direction at a national level and to really make sure that this is an option for older adults and people with disabilities across all of your states. And I know that all of you have been working so hard to maintain and really expand your efforts throughout the COVID-19 pandemic. I'm going to spend just a few minutes today talking about the importance of self-direction to the Administration for Community Living and to talk about some of the major priorities of the Biden-Harris administration and the impacts that those have for self-directed programs. I will start with just sharing a little bit about myself. I'm really privileged to have joined the Administration for Community Living on Inauguration Day as the Principal Deputy Administrator, and I'm currently serving as the Acting Administrator and Assistant Secretary for Aging. And the mission of ACL, which is supporting opportunities for community living for all, has truly been my own personal life mission. I grew up in a family that really valued and was engaged in really the movement to expand opportunities for community living for people with disabilities. And I've seen firsthand the difference that self-directing services has made in the life of my brother and the opportunities that it's really created for him to live the life that he wants in the community. Professionally, I've been involved in advocacy and see so many friends and colleagues' names on the screen. It's really great to see all of you. And not only have I been involved in really the policy side of promoting home and community-based services, but I also come at this work knowing that community living is a civil right and really think about this through a rights-based lens. And I'll just say that it's been such a privilege at ACL to be somewhere where both the disability and aging communities and programs are brought together. And that's been so much of my experience working on shared priorities. Everything from over the last several years to things like reauthorization of Money Follows the Person and the HCBS spousal impoverishment protections to the work that we've done together throughout COVID-19. So let me start by just talking about how important self-direction is to the mission and work at ACL. We have a long-standing commitment to self-direction, and it really is central to our mission and vision. We fund services and supports that are delivered to people throughout networks of community-based disability and aging organizations across the country. We invest in research and education and innovation to help make community living a reality for millions of Americans. And of course, at ACL, we are primarily focused on how do we support people to live the lives that they want in the community. And self-directed programs offer individuals more choice and more control over who provides the services, as well as when and how services are provided, and really gives us opportunity to tailor services to individual preferences and goals. I just want to touch on a couple of the programs and major initiatives that we are already engaged in and have been for quite a while. On the aging side, we administer Older Americans Act, which provides a self-directed care option. And there are over 13,000 individuals across 8 states self-directing Older American Act services now. And that's another area where we're really looking to expand. We've also collaborated with both the Departments of Veterans Affairs and with CMS over the last decade or more to around their self-directed programs. In the Veterans Directed Care, this was a program that the VA and ACL designed and launched about 12 years ago. Fast forward, and ACL is providing technical assistance to 118 aging and disability network organizations that provide veterans-directed care across 37 states, serving nearly 4,000 veterans who are at risk of nursing home admission and want to direct their own care. And this is one place where, we are really looking at how we can leverage programs that allow family and friends to be employed by the veterans and to be paid for those services. In the CMS space, that's of course where so much of self-direction has happened. And I know folks at Applied Self-Direction have been so heavily involved in the expansion of Medicaid-funded self-direction across the program, across the country, with self-direction existing in virtually every state at this point. ACL continues to be very engaged with our partners at CMS in providing consultation and supportive assistance. We worked with CMS in leading the 2014 guidance for implementing person-centered planning and self-directed standards in HCBS services. And we really are hoping that as states are implementing this is really setting some important expectations for self-direction. Because if we're not setting clear standards, we know it's easy to fall short. So that's just some of where we've been. I want to turn now to really talk about the Biden-Harris administration priorities and what that means for self-direction. So to start with the clearest place, obviously on January 20th, I walked in to ACL in the middle of a pandemic that had truly devastated the disability and aging communities, including, of course, people who are participating in self-directed programs. I think speaking as an advocate, so many people in the disability and aging community really felt invisible to some of the solutions being put forward by Congress and the federal government throughout the early part of the pandemic. We saw service disruption, which meant that family caregivers had to pick up for lost services and oftentimes even leave the workforce. We saw the direct care workforce, including self-directed workers, being put under this tremendous strain and pressure. And these workers who are essential were not actually treated as essential when it came to things like being able to access PPE or hazard pay. We saw services having to shut down and completely pivot to providing virtual services. And of course, the biggest devastation was to people who were in institutional and congregate settings where more than a third of deaths have occurred to date, with COVID cases being rampant and the concerns of people who are in the community losing services and being at risk of institutionalization. Over the last 100 days, and certainly there was so much work that ACL was doing prior to this administration, but it was pretty incredible to come in and within a few days see the Biden-Harris administration put out the national COVID strategy and a whole set of executive orders that really, for the first time, recognized the incredible impacts that people with disabilities and older adults have faced. And those national strategy and executive order, which ACL has been part of implementing, focus on a whole range of issues, whether we're talking about vaccine access or testing, protecting the caregiving workforce, or equity. And some of the key issues that we've been working on, I just want to touch on a couple of them. One is around equitable vaccine access. And we know that for so many people with disabilities and older adults, and of course this includes people who are participating in self-directed programs, that if we just say, register online and get yourself to a vaccine site that may or may not be accessible, stand in line, we are going to leave behind the people who are most impacted and most vulnerable. ACL has been working closely with our aging and disability networks across the country, who have been doing incredible work partnering with state and local public health authorities in making sure that we are doing outreach to people with disabilities and older adults, that we are providing the direct services for people who might need assistance with registration or transportation or companion support in vaccine sites, and even identifying people who may need a vaccine to come to them instead of bringing them to a vaccine site. Last month, President Biden announced $100 million of funding from the CDC to ACL to help fund our networks on the ground across the country to really increase this work around vaccine access and addressing vaccine hesitancy. And we are really thrilled to be able to get that funding, and we're seeing incredible work happening across the country. We've also just been expanding a call-in line, a national call-in line that we have had on the aging side called the Elder Care Locator, that really is a resource to help people identify the needs that they might have for vaccine access and get them connected with those direct supports. And just this week, we have done a soft launch of expanding this into the disability space, and more to come on that. We also know that vaccine access is not just about doing the right thing. It's not just about furthering our goals around vaccine equity and reaching the most impacted people, but it is actually a legal requirement when we think about the civil rights of people with disabilities and accessibility. And just 2 weeks ago, ACL, together with our partners at HHS's Office for Civil Rights, put out a package of documents talking about what are the legal obligations that public entities like public health authorities have in terms of accessibility, whether we're talking about website accessibility or accessibility of physical sites, or even the types of modifications that states and local entities need to make to their programs to make sure that it's accessible to people with disabilities and older adults. And we put out as a companion piece some of the work that ACL's networks are doing on the ground to help make that accessibility real. And all of those resources are on ACL's website at acl.gov on a whole resource page that we have around COVID-19. Of course, we've continued doing work in so many areas, but I want to talk about what COVID has meant in self-direction and really maybe some of the unique opportunities that it's created. We have seen that for people who are self-directing, oftentimes they were able to maintain services due to the flexibility of self-directed programs and their ability to employ families as caregivers. In fact, what we've been seeing is that the number of programs and the number of people participating in self-direction has actually grown during the pandemic. And that's in part because of flexibilities that were allowed in place in many states due to the public health emergency. And I think this has really given us this opportunity to lift up the benefits of self-direction. And as we think about kind of the starting to come out of the pandemic, we've really been looking at all the ways that we don't want to return to normal. We want to take some of the lessons learned. And I think the self-directed model and the flexibilities, the hiring of caregivers, the ways that it's really prevented some loss of services is something that I think is going to be really important for us to continue to lift up as we're coming out of the COVID-19 pandemic. The second priority I want to highlight that ACL is working on, and I feel like is truly a once in a generation opportunity, is the Biden-Harris administration on the fact that economic recovery has to include strengthening the care economy. COVID-19 has certainly laid bare the challenges of institutional and congregate settings, and I think created momentum in a way that truly has never existed to expand and strengthen options for people to live and participate and age in place in the community. I think there has probably never been a time that people are thinking harder about alternatives to nursing homes and diversion of people from nursing homes and other types of settings. But it has also shown, COVID-19, how stretched and fragile our current HCBS system is. How fragile the lack of capacity is, how the workforce crisis has really worsened over COVID, and it's really shown a spotlight on how families are often forced to fill in gaps that are created by the lack of services. And that's why it's been so incredible to see this focus both from the administration and Congress. I'm sure every single person who's participating in this webinar is aware that President Biden has proposed, as part of the American Jobs Plan, a $400 billion expansion of home and community-based services, with a focus on ensuring that we strengthen the direct care workforce and address the needs of family caregivers. But everything is not only riding with what is going to happen in the future. Of course, Congress has already, over the last couple months, passed some really incredible opportunities that we and ACL are really pushing forward on. The American Rescue Plan included $12.7 billion to increase funding to home and community-based services through a 10 percentage point FMAP bump. And hopefully quite soon, there will be more guidance out on the street, but it provides states some great flexibilities to not only address really the issues directly related to COVID, but to think about how can we strengthen the systems moving forward. And I think thinking about the role of self-direction and expanding self-direction is going to be a really important part of that conversation that I encourage all of you to engage in with your states as this additional funding comes in. Of course, there was also the reauthorization of Money Follows the Person and the HCBS spousal impoverishment protections. And ACL is working closely with our partners at CMS on how we can really strengthen Money Follows the Person, bring states back in who have dropped out, and really think about how we can make sure that as people are transitioning out of institutional settings to the community, they're given really the full option of ways to receive services and really build the lives that they want in the community. And again, self-direction is a really, really important piece of that. As we're talking about the care economy, addressing the direct care workforce is such an important piece of this. And both Congress is thinking about this, as well as us inside of the federal government. And again, I think we've seen, and COVID has really highlighted, how increasing self-direction, how bringing in people who maybe were not otherwise going to be part of the caregiving workforce are because of personal relationships that they may have with people. Self-direction provides a way to provide workers often increased wages, more flexibility, and as we are thinking about strategies to make caregiving a more valued profession, a well-paid profession, develop career ladders, again, self-direction is a critical part of that solution. And then finally, the third piece in the kind of care economy is thinking about family caregiving. We know because of the lack of formal support, so much of caregiving often falls to informal supports and primarily family caregivers. And there's an estimated around $500 billion annually of unpaid caregiving. And ACL is involved in a number of initiatives around family caregiving, including, most importantly, our implementation of the Raise Family Caregiver Act. And we have an advisory council that's been charged with developing a national strategy around caregiving. We have a report. We've already put out a series of recommendations. Our first report to Congress should be out later this spring. And then we will be developing a national strategy that will go to Congress later this year. And again, when you get a chance to look at our final report, you'll be able to see that again, self-direction and being able to pay family caregivers is a really important part of the solution for family caregivers. And then add into that the president's proposal in the American Families Plan that in order for us to really address some of these issues, we need to focus more on family and medical leave. So family caregivers can do the caregiving that they need to do. So that's another really incredible and important opportunity. And then the last piece I just want to touch on, a third priority in addition to COVID and the care economy, is around equity. From day one, the Biden-Harris administration has really centered equity in everything and put out a number of executive orders directing all federal agencies to think about equity in all of our programs, in all of our works, and identifying barriers. And if you look at the definition of equity, while it certainly centers racial justice, it is really through an intersectional lens, looking at what are the different experiences that a person with a disability or an older adult might face if they are a person of color, if they are LGBTQ, if they live in a rural area. And we in ACL are really trying to look through an equity lens at everything that we do, at our programs, at our networks, and how we're trying to advance policies for people with disabilities and older adults. You know, in our work, because everything we do is about people with disabilities and older adults who in the equity lens are really an underserved community, we're really trying to heighten our focus on the different barriers and experiences that people have based on different identities and different factors that might cause different barriers. We also are working hard across HHS and all of the federal government to make sure that the equity work and really work focused on health disparities includes an intersectional lens that focuses on people with disabilities and older adults. And we know you're doing a lot of important work in this space, and we want to make sure that we're hearing from you about the work that you are doing in your own states, in your own programs to really bring this intersectional equity lens. And we'd really like to be able to lift up and replicate some of the work that you are doing in your own areas. We want to make sure that we're looking across all types of service models when we're looking at barriers. And of course, that includes self-direction. And we are just starting to kind of collect and look at national data on HCBS disparities by different populations, including in self-directed programs. And I'm hoping that we're just starting this work, but that we will have more data and be able to really talk about more programmatic inequities and how to eliminate them over the coming months and years. So let me just close by looking forward a bit. I think we are in an unprecedented moment. COVID has truly laid bare the fragility of our HCBS system, the workforce crisis that we have, and the need for us to strengthen community-based supports for people with disabilities and older adults. At the same time, we really have this opportunity to turn this tragedy into an unprecedented opportunity to really advance our goals in a way I don't think any of us could have even dreamed of a year ago, in making huge changes and huge expansions to the types of services that help people with disabilities and older adults fully participate in their communities and age in place. And of course, self-directed programs need to be centered and need to be a huge part of the solution. We are really looking forward in ACL to working with you as we are advocating across the federal government and using opportunities to educate Congress about how we can meet some of our shared goals. And we are committed to working with you in all of these spaces. So with that, I will stop and turn it over to Casey to see if we have any questions.
Great. Thank you so much, Allison. So we have gotten a few questions. A reminder for folks, if you have questions, you can submit them through the chat. The first question, President Biden's platform on disability issues specifically referenced plans for ACL to develop best practices for self-direction. Can you talk more about how ACL will be implementing this?
Sure. So I think I touched on some of the many ways that we are already, doing this in a number of different spaces. We, the work that we're doing around the veterans-directed programs, the work that we're doing together with our partners at CMS. I think one thing we are really looking to do is in each of these new opportunities that, when President Biden put together his incredible disability plan, I don't think any of us could have imagined some of the opportunities that are existing and out there. So we are looking, we certainly would be happy to talk to you about what would be useful to, put together a compendium of kind of what is happening in states across the board. But we're trying to really take advantage of inserting self-direction as an opportunity in each of the pieces that are out there. So as the HCBS FMAP bump is being rolled out in states, we are really looking to work with our partners at CMS to lift up some best practices, and would love to hear from all of y'all as this starts rolling out about, how your states might be using this funding to expand self-direction. As we are in the space of coming up with proposals and strategies around the direct care workforce, again, another place where we think self-direction and lifting up self-direction is really important. So I don't think this is an either or, and happy to have a follow-up about if there's a kind of specific document that would be useful for ACL to put out, but I'm really committed to finding every opportunity to insert self-direction as part of the solution as policies are being pushed out.
Great, thank you. We received a question about EVV.
Sure.
What role does ACL play in the rollout of EVV? And does ACL collaborate with CMS on this issue? Yeah,
so as I think folks probably know, ACL has been very engaged around EVV. I know we've engaged with stakeholders across the country, and really the important role that we and ACL play is it is part of our job to really raise the concerns of the disability and aging communities. We have really worked with CMS on understanding some of the concerns, whether it's about privacy, whether it's about how if implemented in the wrong way, it could create incentives for people to have to be in their own homes versus being able to go out into the community. And we have had opportunities certainly to share some of those perspectives with Congress about some of the barriers that we see in EVV. What I would encourage all of you to do is, certainly I know Applied Self-Direction has really been playing a leading role in this. There is a statute that mandates EVV. And so we have been working with partners at CMS to find ways to implement that is, I think, as least disruptive, but consistent with the statute. That's kind of the box that we are in HHS, but would really be interested in continuing to see what is happening on the ground, hear concerns. I know we certainly had been very concerned about the cuts to state HCBS funding for states that were not in compliance with EVV, especially at a time when we felt like more funding was needed in states, not less. Obviously, this new HCBS bump kind of helps with some of that, but I'm very much interested in continuing to engage with you and to lift up the concerns from the community and find any way possible to kind of address some of those concerns.
Thank you. Alison, I know we're a few minutes over. Should we wrap up or do you have time for one more?
I think I have time for another question or two.
Okay, great. As an advocate yourself, what advice might you give to advocates who seek to share their feedback and provide support to ACL?
Yeah, so what I would say is, one of the most important things, and I think the role I take incredibly seriously, is in my role as administrator and principal deputy. The role that we play is not only to administer programs and networks, but we serve as the advisor to the Secretary on Disability and Aging Policy. And we absolutely cannot do that if we are not constantly hearing from and engaging with the community. So much of how I spend my time is in meetings with community groups. And so, what I would say is please reach out. Please share information with us. I ask people, if you're sending a letter to Congress about concerns, about priorities, if you're sending a letter to another federal agency, feel free to send it to us. Please request meetings with us. We try to do it in groups as much as possible. And so, if Applied Self-Direction would like to pull together a group on a topic, if we want to have a conversation about EVV, if we want to have a conversation about how self-direction really needs to be part of the direct care workforce kind of solutions that we're coming up with, I'd really invite you to do that. Please send a meeting request to me and we will absolutely make it happen. That is the most important thing that we do. It's something that ACL has always done well. And I can say, having spent so much of my career being an advocate outside of the government, building those relationships with federal agencies is absolutely key. So please reach out and please ask for meetings with us.
Well, Alison, thank you so much. I just want to thank you on behalf of Applied Self-Direction and the broader national self-direction community for taking the time to talk with us today. We know how incredibly busy you are. We have all been working for many years to elevate the conversation about self-direction and raise awareness about the power of this model. And your comments today made clear that self-direction is woven into your future goals at ACL. And we are so grateful for your support on this issue and the important work you and your colleagues at ACL have done for our community. So thank you very much.
Thank you again for having me. This is really, I just want to leave by saying, truly such a once in a lifetime opportunity. I hope everybody feels as motivated as I do. And this is just, we look forward to working together with you to make big and bold change and really on behalf of the people that we all advocate on behalf of, provide services to ourselves or our family members. Thank you for everything that you do. And I am confident that we are on the cusp of some big and bold things. So thank you for having me.
Bye-bye.
Bye.